Good morning, good afternoon. My name is Danny Seabright, president of the US-UAE Business Council. We are based in Washington, D.C., and I want to welcome you to today's discussion with key officials from leading UAE healthcare institutions, including the Dubai Health Authority, the Ministry of Health, U.S Military Hospital, the UAE Embassy in Washington, D.C., and SEHA. Our conversation over the next hour will focus on the implications of the pandemic for the future of healthcare provision in the UAE. Our speakers will also consider the current state of the UAE healthcare sector and discuss opportunities for US-UAE partnerships in helping their respective entities achieve. This event is being held under the auspices of the Business Council's Healthcare Task Force, which we created at the beginning of the pandemic to put even more focus and more attention on the opportunities for partnership for delivering world-class healthcare in the UAE for the future. Moreover, it is meant to set the stage for Arab Health, which will occur in person next week and which the Business Council has supported steadfastly for the last 12 years. Ahead of Arab Health, I should note that the Business Council has published its latest report on the UAE's healthcare sector. We update this report every year, and we just published the latest report last week. It's available on our website. It's an important reference for American companies wanting to learn more about the UAE health sphere. My colleagues David Greenhaw and Amir Al-Salman will put the link to the report also in the chat function. We are delighted to be joined today by nearly 300 guests from government, business, and academia. Some notable guests include officials from the U.S. Department of State, the U.S. Department of Commerce, the U.S. Commercial Service, the U.S. Embassy in Abu Dhabi, the U.S. Consulate in Dubai, the Office of His Highness Sheikh Mohammed bin Rashid, Vice President and Ruler of Dubai, and the UAE Embassy in Washington, D.C. Partners from the states of Georgia, Minnesota, Utah, and Virginia have logged on today as well. Press from the Khaleej Times and law.com are also joining. We'd like to give a shout out to the frontline workers who have worked selflessly during the pandemic to provide the best care for people and citizens, not only in the US and the UAE, but from around the world. And to our logistics partners like Emirates and Etihad, and Dubai Ports World and Abu Dhabi Ports, who have been there to help deliver product and goods and services when needed. Business Council member hospitals who are on with us the call today, such as Baylor St. Luke's Medical Center, Boston Children's Hospital, Brigham and Women's, Cedars-Sinai, Children's National Hospital, Children's Hospital Los Angeles, Children's Hospital of Philadelphia, Cleveland Clinic, Dana-Farber Cancer Institute, Houston Methodist, Indiana University Health, Johns Hopkins, Mayo Clinic, Nationwide Children's Hospital, New York Presbyterian, Penn Medicine, Stanford Medicine, UCLA Health, University Chicago Medicine, and UPMC are on the representation today, represented on the webinar today, and all played incredible roles in the response to COVID-19. We are grateful to have you on board for your commitment and your commitment to the bilateral relationship. If by chance I missed anyone, please put it in the chat function and I'll shout you out a little later in the webinar. I will remind our guests that this webinar is being live streamed. It will be recorded and posted on YouTube, where we expect many more folks to view it in the coming days. Throughout the webinar, please submit any questions through the Q&A or chat functions, and we will monitor and try to incorporate them into the discussion. Without further ado, I'd like to get started. I'm honored to welcome 4 distinguished officials from the UAE's healthcare sector: Professor Alawi Asheki Ali, Deputy Director, Dubai Health Authority; Dr. Khatun Mohammed Al-Blushi, Director of the Hospitals Department at the UAE Ministry of Health and Prevention; Dr. Saif Al-Badwani, Director of the Preventive Medicine Department at the Ministry of Defense and works at Zayed Military Hospital in Abu Dhabi; Dr. Nawal Al-Kabi, Chief Medical Officer, Sheikh Khalifa Medical City, Seha, and with very, very special guests, Dr. Dajoud Bajawi, Senior Medical Advisor, UAE Embassy in Washington, D.C., and our sage advisor in everything that we do in this sector. So with that, Dr. Alawi, I thank you for being here today, and let's start off with you. The floor is yours.
Thank you very much for that introduction, Dan. It's glad to be here and join the panel with colleagues from the UAE and the US. My name is Alawi Al-Sheikh Ali. I'm a cardiologist by training and currently serve as the Deputy Director General of the Dubai Health Authority. And I'm also faculty at the Mohammed bin Rashid University of Medicine Health Sciences, where before joining the DHA, I was the Dean of Medicine and the Provost for the university. Maybe I could, do you want me to, just introduction here, or would you like me to?
No, go ahead. Give a couple thoughts on your experiences over the last year and a half, sir, and any thoughts about looking forward. And I'm going to give each person the chance to do that, and then we'll do the group discussion, if that's okay. I'm just going in the order of, we're going in the order of alphabetized first names, I believe. I'm not sure, but I think that's how my team set it up. So go ahead, sir.
Well, the last year and a half has not been sort of typical of my experience overall. It's just, I'm sure that's the case for everyone on the call. My engagement with the COVID-19 efforts in the UAE have been in the form of being the chair of the scientific advisory group for the Dubai COVID-19 Command and Control Center, which is a center that was formed early 2020 to basically align and coordinate the efforts within the Emirate of Dubai to fight the pandemic in alignment with the national efforts. And I'll be happy to talk more about that. So that's been my involvement over the past year and a half. Obviously, at the same time, for most of the last year and a half, I was still the provost and the dean of medicine of a University of Medicine and Health Sciences in Dubai. So there's a lot of efforts around accommodating the learning process in an academic institution to all the changes and the uncertainties around the pandemic.
Dr. Alawi, thank you. Maybe we'll have a question for you about how you utilized all the online capabilities that were unlocked and utilized during this period. But if I could turn next, please, to Dr. Khaltoum Mohammed Al-Blushi and give her the opportunity to speak. Dr. Khaltoum, please.
Okay, actually, it gives me a great pleasure to be with you today. I'm Dr. Khaltoum Al-Blushi, Director of the Hospitals Department in Ministry of Health and Prevention. I'm family physician by profession. Actually, let me just take you, let me just share these two messages, which was from the leadership of UAE in the beginning of the pandemic. The first message was actually from His Highness Sheikh Mohammed bin Rashid, when he said that for the long time and within the history, there was a question: is it the economy which is leading the politics, or is the politics which is leading the economy? And when pandemic came, it's just recognized by the whole world that the health is the one which is leading both the economy and the politics. Here came actually the power of the health in framing, let's say, any country direction. The second message, actually, if you allow me to share it also, it was from His Highness Sheikh Mohammed bin Zayed. When all the countries was in panic and all the people in the world was in panic, he said the word which actually put all of us in UAE in a relaxed situation. He said, no worries, because you are in United Arab Emirates. Either you are a citizen or not a citizen or non-citizen, don't worry. We consider that the health services as medication, and the food is our priority, and it is a red line that no one should worry about. All of this actually will put the people to ease a bit the pandemic and the stress which they live in. So as it was mentioned by Dr. Alawi, the story, the experience is new for everyone, for all the countries, for all the health authorities. But with all, let's say, negative impact of the pandemic by itself, there is a lot of positive opportunities which develop, and it was put in let's say, in practice, implementation during that 1.5 years, if we'll count them as 1.5 years. So, and actually, I'm very happy to share our experience regarding the hospitals, regarding the patient care, which was given to our patient during the pandemic waves, we will call it, because it's never came as one. It is wave with a lot of surge. So I'm ready to share it later on whenever you will direct any of these questions to me.
Thank you, Dr. Khatun. And thank you so much, Dr. Khatun. And it goes without saying that the UAE's leadership has been visionary during this whole period. And our hat is off to all that your country has done. You've been leaders in testing. You were leaders in vaccine distribution. I mean, across the board, the UAE has set a very, very high standard, and we appreciate and respect that so very, very much. If I could now turn to Dr. Saif Al-Badwawi, Director of the Preventive Medicine Department at the Ministry of Defense, and Zayed Military Hospital in Abu Dhabi. Welcome, sir. Glad to have you on the call today. Please, the floor is yours.
Thank you, Danny, for this introduction. Okay, thank you again for inviting me to be part of this webinar and joining my colleague from UAE and Washington and elaborating the UAE response in addressing the pandemic. I might start with actually saying that I'm in charge of the Preventive Medicine Department under the Ministry of Health, Military Health Executive Directorate, saying that COVID pandemic has been kind of a dominant issue or the cornerstone for all governments lately throughout worldwide. And probably the most concern and issue is how to kind of work in collaboration and kind of working on kind of put all collaboration together, and all government sectors, not only the health sectors, should work together and elaborate more in addressing the pandemic.
Thank you, Dr. Saif. And I'm sure from a military and defense perspective, there's been some very unique experiences and situations in protecting the UAE's fighting men and women in your military services, just as there was in the United States and other militaries around the world. And at some point, maybe you'll say a few words about that going forward. We would appreciate it. I'm now happy to introduce Dr. Nawal Al-Kabi, who is the Chief Medical. Dr. Nawal, we really appreciate you being here today. We know that you're traveling, and we appreciate you taking the time from your schedule while you're traveling. Thank you. The floor is yours.
Thank you, Danny. Assalamu alaikum. Good morning and good evening. My name is Nawal Al-Kabi. I'm a pediatrician and infectious disease physician by training. I'm also the chair of the Infectious Disease and Infection Control Council in Sahha, and the chair of the clinical committee, the National Clinical Committee for COVID-19. So, as you all know, by April 2020, the entire world was in the grip of COVID-19. Huge pressure was put into every level of society, from the families told to quarantine at home, to the government facing a rapidly spreading virus, to the hospitals being flooded with positive cases. And when faced with such huge, impossible challenge, the UAE quickly stepped up to lead the charge against the raging pandemic. And as a nation, we cultivated a unified and systematic response to confront the crisis using a coordinated and collaborative effort spanning across industries. And when COVID-19 emerged nearly 17 months ago, we knew we had visionary, effective, caring, and supportive leadership. We know that we have fundamental public health, an excellent healthcare infrastructure, and an amazing multinational frontliners. And of course, managing such a pandemic requires a lot of things. It requires fast and reliable diagnostic tools, personal protective equipment, therapeutic options, equipments, ventilators, vaccines, and many others. Our relationship with the United States has been long-standing, and the collaboration between the two countries has been very helpful to fight this pandemic. We are working together, and we will continue to work at various levels to stop the pandemic with the least possible negative impact. Thank you so much. Thank you, Danny.
Dr. Nawal, thank you so much. Very much appreciated. Dr. Bajawi, I'm going to give you the floor. And as I told the group earlier, the man in the out of trouble with regard to everything in this sector. Sir, the floor is yours.
Thank you. I want to thank you, Danny, first for having me here today. And also I'm honored to be among my colleagues that worked hard during this pandemic. As you can see them, they are the heroes on the ground and outside also. They aim also to look after all the, the regions. So, and also I'd like to thank you, to praise you, Danny, for all the U.S. Business Council has done to promote events and forums such as this one that enable us to collaborate with many people in attendance, the many institutions represented here today, and with the colleagues, corporations, nonprofits, nations, states across the world who are on this call today. As this past year has shown us, while illness and disease strike, we are all the same. In 2001, after 9/11, we thought the world could not repair itself. We couldn't imagine how we could go back to the old days of easy collaboration and global travel, but we did. And health, and unfortunately illness, was our bridge. That was when we first began to understand that healthcare or medical diplomacy played a critical role in keeping countries and people connected. People who needed the care and providers who could supply its rose above the barriers to find each other. Fast forward to this past year, an even greater challenge to global security presented itself. Unthinkable to anyone alive, and the world could shut down so quickly and dramatically, but it did. And we all quickly also found ourselves in the same boat. While demographics and economics always play a role in health equity, on a human level, and the experience of having a vulnerable parent, a sick child, or the loss of any loved one is perhaps the most profound, similar, and most devastating of human experience, as you know. The world experienced far too much of it since the onset of this pandemic. But out of the scourge the world has been seen in over a century came some of the most extraordinary stories of heroism, humanity, help, and hope. It has never been a greater to start seriously building a stronger world community together to fight this pandemic. All the world's great religions have a similar saying: if you save one life, you save the world. The UAE put those words into action. The Emirates Hope Consortium and the Emirates Alliance launching one of the largest and most integrated logistical efforts of its type to deliver hope and vital vaccines to the global community. Leading the world in the country vaccination level, in testing, the UAE set about leveraging all its public and private resources to facilitate vaccine delivery around the world to resource-poor countries with the aim of delivering billions of vaccines by the end of 2021. As the pandemic has taught us, none of us are safe until we are all safe. Healthcare or medical diplomacy prioritizes the existential sameness of the human condition and universally recognized values of good health and the eradication of disease that are shared by every culture, every race, every religion, every family, and every individual. It's an opportunity to leverage our collective resource to launch a global conversation focused not on the difference that divide us, but rather the shared interest in health and the human condition that bind us. The UAE believes it has a significant role to play in that conversation through the embassy and the world stage, and also through the hard work of my colleagues here on this call. This pandemic has taught us that despite our latest breakthrough discovery, we are not out of the woods yet. And we need to think seriously about developing in-country product for reason of national security. Just think about the serious shortage of PPEs and equipment, such as ventilators, that we were worrisome to the entire world. The UAE has been in the forefront of building capacity for its own country and for its neighbor across the world, because the country leadership has understood and that until we are all safe, none of us are safe. And I close with this. It's important for me to share, because we have to think out of the box. And this can hit us anywhere. Thank you, Dan.
Dr. Bajawi, thank you. And I want to just say, from the beginning of the pandemic, whether it was helping Abbott Laboratories come to you and through the embassy into the UAE with new testing capabilities, working with Moderna and Pfizer on vaccine cooperation for the UAE, working with our various hospitals to provide healthcare in extraordinary cases when required. We're working with our partners like Emirates and Etihad and the ports to provide the goods and services that were required to keep our economies going. You and the embassy have always been an amazing partner, and we appreciate that so very, very much. There are 3 companies that jumped on to say that I didn't shout them out. I'm just going to do that really quickly. That's Baptist Health South in Florida, Henry Ford Health, and there was one other one here, Oceaner Health from Louisiana. So I just want to make sure I mentioned those 3. Let's turn to the discussion here for the remaining 25 or excuse me, for the remaining 30 or 35 minutes, if we could. I want to ask the panelists, what the UAE has been a model, a global model in terms of its response to the pandemic, a very successful response. Just to each of you maybe offer a couple, 3 points from your perspective on what did the UAE as a country do right? What lessons did you learn from that the rest of the world might learn from you? And if any lessons that you learned from what you observed in other countries in their response to the pandemic. And why don't I start first with Dr. Al-Kabi, and then I'll go to Dr. Khaltoum, and we'll go down the list that way. We're going to do ladies first on this one, if that's okay. Dr. Al-Kabi, go ahead.
Sounds good to me, Danny. Thank you, Danny, for this question. So as you know, United Arab Emirates is regarded as one of the best countries in terms of pandemic management. And as per the Deep Knowledge Group, it is among the safest country. And this is for many reasons. I think one of the most important reasons is the effective and visionary leadership. Our leadership was with us from day one, very, very supportive. When I said visionary, I remember very well sitting and discussing in January the testing. At that time, there was no commercial test available in the market. And they asked us to start testing. So our team managed to collect what needed to perform the test. And as soon as we start to perform the test, we diagnose the first case in the Middle East. And believe it or not, within a few weeks, our leadership asked us to plan a testing. At that time, like no one are doing any type of testing, initially they ask us to plan for a few thousand, and within a very short period of time, they ask us, tell us what you need to test over 100,000 a day. No one could think, I'm an infectious disease physician, and I couldn't imagine that I will do 100,000 tests per day. So you can see how visionary they are. Plus that we have an open access when it comes to healthcare. Anyone in the whole country, whether they are insured or non-insured, visitors or residents, they can access our system easily. And that's one of the reasons I think our mortality rate is low, in spite of having a good number of, I will not say good number, but in spite of having several thousand cases, we still managed to maintain a very low mortality. Other things is the number of testing. It's widely available everywhere. You don't need an appointment. We have a drive-through clinics, wherever you need, and the timing. Like if you do the test within a few hours, you will receive your result. And lately, of course, we invested during this pandemic in the trials. Our infrastructure when it comes to clinical trials was not great, but I think this pandemic helped us put the right structure for clinical trials. And we managed to do phase 3 for the inactivated vaccine Sinopharm, for the Sputniks, and lately we started last week the children trials. And last but not least, the gene sequence. We invested a lot on gene sequence, and we will be able to do, actually the direction of our leadership now is to do gene sequence for every single PCR positive case. So as I said earlier, really we are blessed with our visionary and effective leadership.
Dr. Nawal, thank you. I want to come back to you on the children's trials in a
Sure.
future question. That's really, really important and a big deal. And many of our children's hospitals are on the line today as well. And I know they want to hear more about that. But Dr. Khaltoum, go ahead, please. Lessons learned, 2 or 3 for the future.
Okay, maybe I'll not repeat what Dr. Nawal said, and even I mentioned it in my introduction, the leadership and visionary leadership. Actually, this is reflected on the health system. We have a strong health system in United Arab Emirates with all the levels, starting from the preventive medicine and public health, moving to the primary health care, which will be the first gate for any of the patient, referring them to the hospitals and of course, to receive the management, going to a tertiary hospital whenever the intervention is required. So one of actually the strong health system, which was implemented, and actually it was there in United Arab Emirates, actually as a foundation, in a way that whenever this health system was strong enough, it's shown in the pandemic that it was strong and it passed the pandemic with, let's say, a bit of ease, or the way that reduced the impact of the disease. The second thing, actually, other than the collaboration between different levels of health system, that the country by itself, or let's say the government by itself, it was supporting the health system and providing the new whatever management or treatment is available. And this is actually was through the strong relationship which was with the partner, with the strategic partners, including, of course, to the governmental levels. And here it was shown with the, let's say, vaccination, which was introduced, the medication, which was introduced, let's say, including the trials or emergency approval of this medication, reaching, of course, to the investigation tools of which was used and available in the country. So all of these actually showed, and it never will happen whenever it will come, let's say, of a sudden during the pandemic. Actually, it's shown that how the health system was built on as a foundation as a preparedness for all of these, let's say, crisis which was there. And it's shown how the collaboration or the easy the system to move from one level to another. And this is reflected, as Dr. Nawal mentioned, with the less mortalities as compared to the number of cases which was reported in other countries.
Dr. Khaltoum, thank you. Ladies and gentlemen, we have a few questions from the audience that I'm just going to insert here because I think they're related to the pandemic, and I'm just going to list the 3 or 4 questions. And if any of you want to jump in and give an answer after I list the 3 or 4 questions, please do so. How many COVID-19 deaths have there been in the UAE to date? Has the UAE used monoclonal antibody therapies during early treatment? Let me see here. There was 1 or 2 other ones. Curious about the state of scanners that they read in the news that Abu Dhabi has employed recently. This is really amazing, and would love to know about this unique system and how you employed it. Another question, would it be possible to pursue a pilot on symptom-based syndromic surveillance system in the UAE with regard to these sorts of things? One last question, if I could here. Can you please elaborate on the contract tracing experience in the UAE, partners, lessons learned, and that sort of thing? And I think that will do it with regard to the questions on the pandemic. There's some other questions here that we'll tackle later on. Oh, here's one last one. And this one, Dr. Bajawi, you might know the answer to. For the audience, when do you think that fully vaccinated people can travel to the UAE without taking the PCR test? I thought I saw something that was already happening in some places, but I leave it to the experts to let us know. Go ahead, please. I gave you a lot of questions. Dr. Khaltoum, do you want to start?
Yes, yes. Actually, I'll start with the 2 questions, which was the first from the list. The first question about the mortality is actually, as it was directed by the government of and leadership from United Arab Emirates, all the numbers, all the percent of, let's say, either positive cases, the mortalities, the recovered cases, all of these, it was published, and whoever is interested, they can go to the website of United Arab Emirates and can have an idea about all these published data. So the leadership of United Arab Emirates has followed the transparency of sharing the information, because it will be, of course, of the help for us as a management or whoever is within the country, and even for people, let's say, outside the country. The second actually question, it was about the monoclonal management. This is actually one, of course, direction too, and or let's say one of the way that the people, or let's say the health system in United Arab Emirates followed. It's the dynamic changes or updating of the protocol of the management. So the monoclonal was one actually of the modalities which we started in management of a COVID patient. And we got actually a very successful result in these patients. And lately, actually, United Arab Emirates was one of the first countries to introduce the monoclonal, which was issued or manufactured by GSK. After the FDA approval as an emergency use for a COVID patient. So actually, this is the way which we let's say somehow contain the pandemic as a dynamic thinking, dynamic way of managing of this pandemic.
Gentlemen, maybe you can comment on the questions about how many deaths in the UAE, if you know, and also about the PCR test. Where is it still required, in Abu Dhabi, Dubai, or not? I want to get some of the men to say a few words here.
I just posted a link on the Q&A where the official statistics related to COVID-19 in the UAE are posted daily. And there you could find the up-to-date number of new cases, cases, cumulative and new number of deaths. So the total deaths to date are 1,741, which brings the case fatality rate in the UAE to 0.3%. And you'll see on that link also the number of tests, the number of vaccinations, the number of cases, and these are the official statistics updated daily by the UAE government.
Thank you. That's very helpful. We really appreciate it. Maybe
may I add?
Please.
Actually, the emergency response in UAE, as is organized and managed officially by the National Emergency Response and Management Authority, is also supported by all healthcare and government sector representatives through the technical committees. These committees usually sit and meet together and kind of alert the government and alert the healthcare system if there's any kind of an outbreak or and issues internationally need to be kind of addressed throughout the country. So having such system will foster the initial response in the country in response to any pandemic throughout the time.
And my understanding is, Dr. Saif, is that you've really, as a result of the pandemic, you've really bolstered and build up this response, this emergency national response.
I mean, talking about the UAE, such committees was in meeting and discussing the response to the outbreak in China, even before the WHO was declaring the pandemic. So that's kind of will highlight the response.
I was in the UAE.
Yeah. So that's one
I was in the
UAE
the
other thing. And as Dr. Nawal said and addressed, having the grounds for the clinical trials in the country, as what happened throughout the phase 3 trial for the Sinopharm vaccine in the country, actually established a good grounds in the country for the coming years to have more clinical trials in terms of medications or even vaccines that will establish will improve the infrastructure within the country for upcoming years.
That's wonderful. There's a lot of interest in international patient care and from our members on the webinar, and perhaps we turn to that a little bit in the discussion. I'm looking at the time. We have a number of world-renowned hospitals who are our partners, our members, if you will, of the Business Council. They have incredible partnerships on the ground in the UAE, the Cleveland Clinic, Mayo Clinic, Johns Hopkins University and Johns Hopkins Medical Center out of Baltimore. I could go on and on, but these three major American institutions are very well established in the UAE and growing with brick and mortar all the time. Talk to us a little bit today about the status of international patient healthcare. And I know, Dr. Al-Kaabi, you wanted to say a few words about that in particular. And in terms of opportunities for other American companies and organizations to get more involved than they are already in providing healthcare back in the US, if you will, in the future for UAE patients. Go ahead, Dr. Al-Kaabi.
Thank you, Danny, for this question. So, of course, the pandemic impacted all other healthcare services, and that include the international patient services. And however, with the help of our American hospitals, we were successful in mobilizing the urgent cases in the middle of the pandemic. However, many cases was postponed due to the travel restrictions, due to the pandemic, due so many other reasons. However, we start to implement more of use teleconsultation. We start to implement multidisciplinary team meetings between our team and the American hospitals, and the patients feel more satisfied that they can see their physicians, they can hear the feedback from their physicians in US. And now the teleconsultation is used extensively to manage chronic diseases. I couldn't imagine that we'll use it that extensively more than 17 months ago, but now we are really using it a lot to manage our own patients and to communicate with the international hospitals. Now, I do believe that once the pandemic is over, we'll continue our business with different American hospitals. It's been the choice number one for most of our patients and our physicians. They prefer that to refer the patients, the complex one, those who need a transplant or need a very complex surgery. Most of them prefer to refer them to the American hospitals due to well-established system, well-known outcome, and patients are very satisfied after they go to the United States hospitals. So I think, yes, we are going back, and we are thinking, hopefully, we'll try to collaborate further, not only in sending our patients to do certain surgeries, but also in education, in sending our residents to do residency and fellowship, to collaborate further in research. We have Mayo Clinic and Cleveland Clinic in UAE, and I don't think the market is saturated, because there is always things we can work together to improve the healthcare system and the education system in UAE.
Let's come to the saturation question in a moment, but I wanted to ask Dr. Alawi to say a few words about the education aspect and the opportunities for partnership in the areas of training the next generation of Emirati healthcare professionals. Go ahead, Doctor.
Yeah, maybe I'll link the answer to that question, Danny, to the previous question that Dr. Nawal addressed. And traditionally, the international mission of US institutions when it comes to the UAE or the region have really focused on providing care for patients who would travel from the region to the US. That then evolved into physical presence of US institutions in the region. And you've mentioned some names there, but I think the gradient that's fed that mission, that relatively narrow mission, has been shrinking. And actually with COVID, it shrunk even more, because the patients who were going abroad were forced to stay in the country. And many of them realized that, you know what, you could actually get good care here. So I think if I put myself in the shoes of a US institution that's looking for patient flow, I would challenge myself and ask her, what is my international mission really? What do I want from my international outreach officer? It's not, and the answer would be, what used to be the international patient office really should be the international mission office. So what kind of footprint do these US institutions want to see beyond the borders of the US? And for that, I think education and research offer alternatives to maybe to bring that gradient to a state that can actually stimulate the relationship further. Because if the old model of relying on patients traveling from the region to the US for care, I don't think is sustainable anymore as health systems in the region develop and more complex care is available locally. Some of that is happening in the US itself. I mean, many of the large academic medical centers are being forced to go to the community and take that care back to the community, rather than relying on the old model of they're going to come to the big city, So I would challenge U.S. institutions to think of what will be a more sustainable model for their international mission. And that's where education and research, I think, would play a big role. I think there's huge appetite for North American, particularly postgraduate training. There is now more appetite than ever for collaboration on biomedical research. And it's worth focusing on those and thinking of a sustainable business model the long run.
Dr. Alawi, those are fantastic points. And I want to ask your colleagues on the webinar if they want to comment on that. I worked in the U.S. Defense Department for many years, and we talked always about the importance of putting boots on the ground, if you will, with our partners and friends around the world, particularly in the Middle East. So is it important that I hear what you're saying on two levels. It's important for American institutions to think about how they put more of what they're doing directly on the ground in the UAE for the future, and create new opportunities for educational and research partnerships in the United States. And so I'll ask Dr. Khaltoum, I'll ask Dr. Saif, I'll ask Dr. Nawal to jump in and comment on that, please.
Yeah,
Dr.
Danny,
Khaltoum,
if you allow,
next?
yes, yeah, please. If you allow me actually to add on also other way of collaboration between let's say the health system or institutes in United Arab Emirates and United States, it's about the visiting consultant program. Actually, in Ministry of Health and Prevention, we have actually a very strong relationship with the, let's say, a figured institution in United States. One of them is CHOP, which is Children of Philadelphia Hospital, which also it is not, we took actually our relationship with CHOP beyond, let's say, only visiting consultant as a physician or consultant which will come and provide the services to our patient. It is also that for the last 3 or 4 years, through our participation in the Arab Health Exhibition, which you mentioned maybe in the beginning of a webinar, which will be physically present next week, we have actually the prototypes project, which is developed by the CHOP, let's say, institute. It presented on the stand of the Ministry of Health and Prevention. And this year, actually, we are proud to announce that there is 3 of, let's say, project which is under the prototype and the research. It will be shown on the stand. So anyone who will be let's say, visiting Arab Health next week, they are welcome to visit our stand and just to have a look on how, let's say, we are presenting the project of our partners. So the visiting consultant, this is actually one of the programs which is going on. CHOP, this is one of our partner, and of course, Children Washington Hospital, which we are really have a good and strong relationship with the exchange of, let's say, experiences and the visiting consultant program. So all of this is an opportunities for any of the institute in US who are thinking to collaborate with United Arab Emirates Health Institute or authorities.
Does anyone else want to comment on any of these?
If you allow me, Danny, just to add on, I think the rhythm of international patient care traveling to US will increase over time. That depends on how the pandemic will go in the next few months. And hopefully that will settle and things will improve and more patients will be traveling to US. But I think it would be good for the US counterparts to take an opportunity and try and probably reach out to patients through the teleconferences and other services in UAE. There's several kind of platforms being already approved by the UAE government to be utilized for teleconference throughout the healthcare systems here in UAE. So that could be utilized for patients' care too. In addition, probably might be a good opportunity for the US counterpart to consider opening a specialized services in UAE. It depends on the type of patient traveling to US. So we'll probably outreach the patients in UAE and nearby countries here might be a good opportunities and might be discussed through Arab Health or one kind of face-to-face meetings.
Danny, if I may
mentioned
add,
Go ahead, Dr. Bijawi,
yeah,
please.
Sorry,
please.
if I might add to Dr. Nawal and Dr. Alawi and Dr. Saif, importance of the international mission. It is true now. The patient has now because of the pandemic, they realize that we have a good health care system in UAE. And that's the reason now what Dr. Alawi has, stipulated very clearly. The needs are more in the international education, especially in research and clinical trial. That's where the need are. We need to figure out how, to do the exchange, how UAE can be part of the research collaboration and clinical trials. And that's important for, message to the US hospital today, that it's important to realize that now and ever that, the healthcare in UAE has its own now quality care. So that's why they, but nevertheless, we're still in partners with the US. They are important partners to us, and we're gonna continue working with them. And there are important partners. So that's why, we have, as Dr. Alawi said, he started, I have to, to honor him for this. He started this MBRU because there is a need for education and in medical field. There is a need, and he needs collaboration with many of the medical institutions in UAE, and I mean in the US. And that's why I want to add this important, fact. That's
great, sir. We talked throughout the conversation about how the virtual environment has changed. The UAE has unlocked at the beginning of the pandemic a number of platforms. Telemedicine is taking off, as some have said, and is growing. We work closely with UAE authorities on the overall digital scope for the future in the UAE, and I'm just curious if there's anything new to say in that regard from healthcare standpoint about telemedicine for the future, sharing the patient record. Do you see more advancements in these areas on the digital domain between American and UAE institutions? Does anyone want to comment on that?
Yeah, if you allow me, actually, Danny, it was recognized during the pandemic that there is a shortage of health professionals, especially for the intensive care services. So actually, this is an experience which was within Ministry of Health and Prevention, which was actually piloted before, is then EICU. EICU, it's on a way that all, let's say, medical records of the patient will be shared through the hub of the intensivist, who will review the cases and accordingly will put their input, oral advice, recommendation within the system. So this was actually one of the way in order to overcome the challenge of, let's say, difficulties of getting intensivist. So this is actually one of the opportunities which could be an open collaboration or cooperation between the health system and big institutes in United States. About sharing the information and sharing the data, actually, we have like a law within the United Arab Emirates that for the patient privacy and securing the patient data, there is a certain steps to be followed in order to send the medical records by itself to another institute. But it's never actually difficult to be done. So I think this is one of the way that the collaboration could be an opportunity for an exchange of the knowledge and experience and to support each other in this way. So it's ready there, actually. It's ready.
Thank you. Dr. Nawal, we have a couple questions that I want to close with, but I want to give you the chance to tell us a little bit about what you're doing with pediatric testing on COVID really quickly, because I know this is really important and we're all watching it and want to see what you're doing. So tell us.
Thank you, Danny. So last week we announced that we started a study. It's called Immunogenicity Non-Inferiority Immune Bridging Study of Inactivated SARS-CoV-2 Vaccine in healthy population aged 3 to 17 years versus healthy population aged 18 years old and above. So the phase is immune bridging study, and this is one of the phases that we can get data for children without using placebo. The study already conducted in China, and this is a different part of the study will be conducted in UAE. And the vaccine we are testing is the BIBP, which is the same vaccine registered in UAE for adults. And our primary objective is to evaluate the immunogenicity, non-inferiority of inactivated SARS-CoV-2 vaccine in this population. And the secondary objective is to evaluate the safety in children. So we anticipate, we are looking to recruit 900 children versus 900 adults. And I think soon we'll be able to complete the recruitment, and we'll share, of course, with the world our results once it's ready.
This is outstanding. Thank you so much. Ladies and gentlemen, we're five or 6 minutes left here. The UAE expanded its domestic capability to produce medical supplies and even devices during the pandemic. And during the past year, companies like Mubadala and Honeywell have worked to produce PPE in the UAE, while Jolfar has been producing the Sinopharm vaccines within the UAE. This is all in line with the UAE's goals of being more resilient and self-sustaining. Is there anything more that we should be looking for in the months ahead? Is there anything more that any of you would like to highlight in this regard that's needed in the next 6 months to a year in the UAE? And if you don't have a comment, it's fine. I just wanted to highlight that this is an area that's seeing a lot of new developments. Okay.
Yeah.
Go ahead, Dr. Khatun.
Yeah, actually, it's just to stress maybe the same which you mentioned, that Jolfar, and let's say there is a lot of opportunities for manufacturing of drugs and medicine in United Arab Emirates. So this is an opportunity for any of the interested companies or factories from US. Vaccine development and vaccine manufacturer also, they are very welcome to invest in United Arab Emirates, adding to it the PPE, which will be, let's say, one, of course, of opportunities also in the countries. So just to state it maybe, and that United Arab Emirates is welcoming the investment in the health sectors, either from service opportunities of providing services and starting the institution by itself, or to be shared as an outsource of the services within the governmental entities, moving toward the manufacturing of either medicine, vaccines, or let's say consumables and PPEs whenever it's needed. So there is a lot of opportunities for the investment in UAE, and of course US as strategic partners, as a country in the governmental level, they are welcomed in order to start their business within UAE.
And all of these issues and all of these opportunities will be discussed and on display next week at Arab Health. Sure. Opportunities for future further conversations and exploration of ways to work together and help the UAE more broadly in these areas. Further afield, this fall Expo 2020 is going to be a great opportunity for the UAE, yes, to showcase itself to the world, especially as we get ready to celebrate your golden jubilee as 50 years as a country here in December. So there's a whole week at Expo 2020 being dedicated to health and wellness. The Business Council is going to be there and be part of it. And we look forward to helping you celebrate your 50th anniversary. A final question I'm going to ask to Dr. Bajawi, and then if any of you want to comment on it after you hear his remark, we'll close with that. I ask our panelists on a lot of the webinars that we host, what keeps them up at night? What do they worry about when they wake up at 3 a.m. to look at their Twitter feed to see who's been tweeting around the world? What keeps them up around? What do they worry about? What do they think about? Dr. Bajawi, the floor is yours.
Okay. Well, to be honest, Danny, with you, it's actually the phone calls and the WhatsApp messages from UAE because of the time difference. But that's what really keeps me awake. But leaving the joke aside, if you ask me what I worry about, it's that until all of us, again, I repeat that, until all of us are safe, none of us are safe. So we don't just flip a switch and say the pandemic is over. Wealthier nations have to ensure poor nations get the resources they need to vaccinate their people, and all of us, even once vaccinated, need to continue to practice the safest habit and hygiene that we have learned over this past 18 months. And this is my message for the entire world. And then I'll return. Dr. Alawi, what keeps you awake at night?
I mean, fortunately, I sleep well most nights, but I would say what worries me the most, particularly with the pandemic, is a patient who needs care and would not have access to it and cannot get access to it. So I think capacity planning in the pandemic is something that worries me the most.
Capacity planning, okay. Ladies, Dr. Saif, anything else? Keep night?
Probably start with the ladies.
Actually, for me, I will not say what worrying me. I'll just take it to another direction. What I'm waiting for as a news that there will be an announcement that we are free of the pandemic. COVID is no more actually a nightmares for all the countries. We will feel moving around, let's say, so easily, so safely, and traveling to US. I'm missing to US actually. To be honest, I'm missing it. So this is actually what I'm waiting for as a news. Of course, it will be reflected to the care of our patients and our, let's say, people within the country.
Thank you, Dr. Haltoum. Dr. Nawal?
Thank you.
Yes, so what's keep me up at night beside the thousands calls I receive every day, actually this is not the first and not the last pandemic. Yeah. We should learn from this pandemic and remember plan for the next pandemic, and collaboration, learn from each other experience. Viruses are very smart and they were here before us, and I think they will stay after us. So we need to know how to prepare ourselves as human. We need to work together to fight all the threats. This threat actually united all the world against the pandemic, and we should learn from this, and we should prepare ourselves. And we should also provide help to the other countries that cannot prepare, or they don't have the access to the healthcare, to the vaccines, to the equipments. I think we need to remember that we are all in one boat. And as Dr. Jawad said earlier, if no one's safe unless everyone is safe.
Everyone safe. Yes, true.
Yeah. Thank you, Dr. Nawal. Dr. Saif.
I have to talk about military, at least at the end. As a military medical person, I always have to think about how this pandemic is going to affect the readiness of our forces and be ready at all time, always. And keeping that in mind, the national security is all dependent on us. So we have to keep our readiness high and up to the point all the time, regardless of the pandemic.
Dr. Saif, that's our challenge and our mission with the Defense Department and the military forces for sure. And thank you for what you do. Thank you for what you do with our military partners to see that mission fulfilled. We really appreciate it. Ladies and gentlemen, this brings us to the conclusion. Thank you so much, doctors, for all of your participation today. I know this takes an hour out of your day. To our attendees, there were a number of questions we didn't get to. We've taken note of those. We're going to try to do our best to get you answers to those questions and get you contact details for panelists on the webinar today. Thank you so much. We hope to see you next week when we host a seminar on climate change with representatives of Dr. Sultan Al-Jaber's office and Secretary Kerry's office in Washington, D.C. We appreciate your time and attendance today. And could I say good Arab health to everyone. And I hope this is the beginning of back to in-person collaboration. And I look forward to seeing all of you soon face-to-face. With all warm regards, take care today.
Thank you.
Thank you. Thank you. Thank you very much. Thank you. Thank you.